The vaccine.
I'm not taking vaccine. So it's creating mental
Good afternoon and welcome to the Liberia Medical Dental Association press conference. Because of what is obtained in Liberia now regarding COVID-19 situation, the Liberia Medical Association, the professional group of all doctors and dentists in Liberia, have decided to speak to the Liberian people, to speak to the government of Liberia and to the public at large, and all our patients, and also to other health workers. Welcome. Today we have a prepared press statement that will be read by the Acting Secretary General, Dr. Moses Zia. We also have in attendance today our chaplain, Dr. Augustine J. Kuya, and I'm Dr. Emmanuel Kinaba, President LMDA. So Dr. Zia.
Good afternoon, members of the press, and good afternoon to the general public. I will be reading the press statement of the Liberia Medical and Dental Association in regards to the recent COVID-19 situation. The Liberia Medical and Dental Association wishes to inform the press and general public that it is deeply concerned and particularly worried about the recent resurgence in the number of COVID-19 cases in Liberia, with new variants being reported at the moment. We extend our sympathy to all those afflicted by this disease and the grieving families of those who have lost. This third wave of COVID-19 infections has demonstrated to be nothing like what we have seen over the past 18 months since Liberia reported its first case back in March 2020. The current daily number of new infections, severity of cases, and death rates are all alarming and unprecedented. The need for medical and other supplies, including oxygen cylinders and delivery apparatus, medication, etc., remain a huge challenge at the health facilities and is hampering the ability of clinicians to provide adequate care to COVID-19 patients. At the moment, Liberia is one of the countries reporting the highest number of new cases in the entire West Africa sub-region. This is disheartening, and it's now time that we as a nation put together forces more than ever before to fight if we should stand a chance against this disease. Being the umbrella institution of all medical doctors and dentists in Liberia, the Liberia Medical and Dental Association remains a mix with its members. Starting with the general public, the Liberia Medical and Dental Association recommends the following. 1. That everyone must adhere to safety measures recommended by the government of Liberia through the health authorities. These safety measures include, but not limited to, the mandatory wearing of nose masks in public, avoidance of crowded places, avoidance of observance of social distancing, frequent hand washing, etc. 2. That individuals experiencing respiratory symptoms present themselves immediately for voluntary testing and be willing to get isolated if they test positive. We also advise individuals within communities to report sick people who refuse to seek care at health centers, as doing so will help break the chain of transmission if those sick persons are infected with the virus. We are also noticing that patients are presenting very late at the treatment center, especially at the point when there is little or nothing that can be done for them. We encourage people to present themselves as early as possible when they feel unwell in order to access prompt intervention. 3. That every single and eligible person must endeavor to get vaccinated The vaccines are safe and authorized by the requisite authorities for use in humans. Although they do not guarantee full immunity, these vaccines are known to significantly reduce the risk of contracting the disease and also reduce the risk of having severe disease if one contracts the virus. 4. That well-meaning Liberians, foreign nationals residing in Liberia, and development partners join the fight by providing whatever little support, whether supplies or cash, to the health sector to augment government's effort in the fight against COVID-19. We have experienced that effective COVID response is a very expensive initiative. Hence, it is time that we all mobilize resources to defeat this common enemy. Now to health workers. The LMDA first appreciate your role and merit sacrifices you make daily by working under the most derelict circumstances. To all of you, our doctors, pharmacists, physician assistants, nurses, nurse aides, midwives, laboratory and X-ray technicians, as well as respiratory therapists and other support staff, especially those working in the front lines, we want to say a big thank you to you all for what you do for humanity. During these difficult times in our nation, the general population look to you for direction and hope. We should all come forth and stand in unison to fight this disease using our expertise and experiences. 2. LMDA encourages all healthcare workers to observe universal precautions in regards to infection, prevention, and control, and to stay safe at all times as they discharge their professional duties. It is our responsibilities as health workers to keep safe while serving. 3. We encourage healthcare workers to take the lead and set precedents. We should all get vaccinated as we remain at higher risk of contracting the virus. We should help as well in spreading accurate health messages to the general public in order to dispel the propagating myth and conspiracy theories within the already gullible population. Now to the government of Liberia. LMDA acknowledges with gratitude the support of the government of Liberia to the health sector, especially during the first 2 waves of the COVID-19 pandemic in Liberia. Those hard decisions you made, including the nationwide lockdown, even in the midst of harsh economic situations, helped in curtailing the previous waves. With how things are now proceeding, LMDA hereby recommends the following. 1. That the government of Liberia must seek all help it can get from all sources to invest hugely in the health sector during this critical moment. Such investment has to be immediate as the situation is rapidly worsening across the country. 2. That the government of Liberia should consider implementing an immediate nationwide lockdown in order to initiate massive contact tracing and arrest the rapid spread of the virus within the population as things are getting fast out of hand. 3. That the government of Liberia, through the Ministry of Health, consider opening additional isolation and treatment centers around the country immediately, since the current available facilities are running out of space and capacity and supplies to accommodate the increasing number of symptomatic COVID-19 cases. We also recommend the isolation of all COVID-19 cases, whether symptomatic or asymptomatic, as was done during the first wave. Considering our context, taking all cases from the community will help in breaking the chain of transmission faster. 4. That the government of Liberia must ensure the protection of all healthcare workers by supplying all needed personal protective equipment in all facilities and at all times. Lack of personal protective equipment will lead to increased infection amongst health workers, which will cause panic and demotivation to others, thus undermining the entire fight against the disease. 5. That the government of Liberia, through the Ministry of Health, should consider expanding and decentralizing testing facilities so as to shorten the turnaround time of COVID-19 results. This will help in confirming diagnosis fast and isolating positive cases immediately. The government is encouraged to collaborate with the private sector, if possible, and ensure validation of results through the National Reference Lab. 6. That the government of Liberia must become proactive and ensure sufficient supplies of vaccines quickly to vaccinate the population. While efforts are being made to seek help from international partners, the government of Liberia must consider making significant investment to secure vaccines in a timely manner. 7. That the government of Liberia, through the Ministry of Health and National Public Health Institute of Liberia, consider recruiting the services of the appropriate experts during this health crisis. We as a nation cannot afford playing politics while the precious lives of our people are being lost on a daily basis. We must learn from previous experiences in order to improve the quality of the response at this time. 8. The government of Liberia, through the health authorities, must make deliberate efforts to improve community engagement, as doing so will enhance the compliance of community dwellers to the safety measures. Individuals with the right knowledge and expertise should be recruited to engage the communities through accurate information dissemination, contact tracing, among others. 9. That the government of Liberia, through the Ministry of Health and National Public Health Institute of Liberia, consider incorporating the Liberia Medical and Dental Association and other professional health bodies at the core of the response, since these institutions remain major stakeholders in the health sector. In the midst of many challenges confronting the health sector, prevention is our only chance to defeat this common enemy. We must therefore do all that we can to break the chain of transmission, especially at the community level. We believe that the recommendations herein contained will assist in the fight against COVID-19 and therefore expect that they will be taken seriously. The Liberia Medical and Dental Association remains committed to working with the government of Liberia through the health authorities to bring this crisis to an end in the soonest possible time. May God bless us all and save us from this pandemic. Thank you.
Thank you, Dr. Zia. That's the official press statement from the Liberia Medical Dental Association. We now open ourselves up to the media. If you have any questions or need clarification, and now the points raised.
Yeah.
Yes.
So my name is Mike Gray, and I work for the Creative Man Television, KMTV. Through Dr. Zia elaboration, he mentioned that the government should be able to call for support in helping combat this disease. And in recent time, we heard about a politician in person of Ibrahim Darius DeLong made a contribution to the Moserado health team, and that contribution was denied. So what if other private citizens and other politicians are also helping this and people are doing politically? How can you reconcile that?
Okay, thank you very much for that question. As we stated in the press conference, we think it is time that we rally every support possible to help. Okay? If you were in a situation where your house is on fire and you need to turn that fire off, you will as much use whatever help available unto you. So this is a plea to national government that as a country, we should all work together to be able to mobilize all the resources needed to fight and combat this disease. Because as you know, the death rate is increasing rapidly. The number of new infections the number is on the rise. And if we should win, we have to work in union. We have to consolidate all effort. So it's a general plea from LMDA that the government and every well-meaning Liberian, including private citizens and development partners, should all work together and rally all resources that we can get to be able to fight the disease. Thank you.
Then to buttress that point, fighting the COVID-19 pandemic is a very expensive venture. Remember, we have routine services to provide, and then we have this emergency that we are already challenged as a health system for. So, unlike the Ebola viral disease, where a lot of help came because it was only in West Africa and other countries, this year is a global emergency. So we all have to harness our resources, and it's very expensive. Being at the front line is very heartbreaking that we can't do certain things because medications are not available, oxygen cylinders are not available. We don't have personal protective equipment to protect the doctors in some instances. So it is a desperate situation, and we are pleading as doctors on the front line.
Yeah, my name is Fokari Taylor from School Network. I listen to Dr. Zia very well, and there are others who are calling for schools to remain closed. Currently, as we speak, Liberia, Sierra Leone, and Namibia are three countries that is highly hit due to the COVID-19. There are others who are calling for the closure of schools. Where do you stand as the Liberia Medical and Dental Association on that?
Okay, so we've already indicated in the first statement that we're calling for a nationwide lockdown, and that means schools will be closed. The reason why we are calling for this is because of our experience during the first and second waves. If you can remember vividly well, there was nationwide lockdown, even though at some point in time, there were modifications to the lockdown. But you understand that we had a very good response initially, in part because of some of those measures that we took, and also in part because of the strain of the virus we had at the time. At this point in time, we have understood that this variant is even more virulent, all right? It is causing more severe diseases, and as a physician working at the front line and seeing what's happening, I think we should even do way more than what we did before. So to start with, I believe a nationwide lockdown will be very appropriate and prudent at the moment, giving the government and all entities the time to be able to rapidly identify the hotspots and begin to trace those individuals who may have been in contact with infected cases. With that, I believe that we stand a chance, to be able to contain the spread of the infection sooner.
Yeah. I wanted to buttress what we have just said. I guess we are all aware of what is going on around the world. We are facing a fight that has to do with disease. And the disease we are talking about, it does not belong to any country, race, or tribe. The disease did not ask Liberia, say, we want to come to visit Liberia, so give us visa. Are you getting me? We can see before our very eyes, hundreds and thousands of people have died. Some people countries have had almost like 500,000 deaths, like Brazil. Other countries around the world, next to America, Brazil, have 500,000 plus deaths. Currently going on. People are dying and dying and dying. Diseases, if we have to overcome, we have to put aside all our differences and come together in unity as a country. One people, with God above us, putting all our efforts together, we can overcome. Let us forget about who we belong to, or whether we social class we belong to, or party we belong to. No, coronavirus have no identity with any political party, with any school, with any religion, or even tribe. The virus is a virus, and it's killing indiscriminately. Whether you're young, whether you're old, it's just a attack. And we can only overcome the virus if we, as a community of people, go down to the grassroots level and apply the basic measures that we have learned over the time, especially during the Ebola virus disease. It was through community effort that we overcame. Washing hands, social distance, using the nose masks, we can make it. So it's an appeal to every Liberian, from the president to the least person in the village. If we all come together as a people, we, I believe, will overcome this virus that is killing people around the world. Thank you.
Just to address that, the best strategy for this COVID-19 fight is prevention. Even with the cases that we are already overwhelmed. So if we can have an effective preventive strategy, and that's what the lockdown that we are calling for is. I know it got implications for economics, for education and other things, but right now, the best thing to do is do a lockdown, we'll get the cases, and we can gradually open up. But we as health workers, from what we are saying, it's an overwhelming situation, and it's getting desperate day by day. We need all that we can do to get this thing under control, and the sooner the better for us.
Yeah. Okay, I'm Joseph Sion from Liberia Broadcasting System, LBS. That I listened to you very well. You are proposing or recommending a lockdown for the country, but now there are massive concern in the public there regarding the source of this new variants of virus in our country. I don't know whether you have had any knowledge as to how it entered our country, because many times people want to know the source, then you can be able to tackle that. That's my first question. The second question is, we want to know also, because you call your own professional institution, and the media play a very cardinal role. And we didn't listen to you calling the media, the involvement of the media in this fight. The media is a very key player, I think, from what I have experienced in my work in the media has been very much strong in helping to fight the virus. So I don't know what the media will not highlighted in your press statement, in your statement release. That's my second question.
Okay, so just to respond, thank you so much for that question. To respond to the first question, is that we are reliving the moment. Okay, we remember the first time we got a case in Liberia was on March 16, 2020. And there was a traveler that came in country, and in less than no time we have community spread. It's exactly the same picture. The airports are open. There are travelers going back and forth in the country. So for the new variant to have come here, it definitely meant that some traveler brought it in. Alright? What measures have been set in place to really restrict travelers from getting into the community? Probably it wasn't enough. It wasn't working well. Right now, we have a massive community spread. So we can safely insinuate that a traveler might have brought in the new variant. But now we have community spread that we must deal with. Okay? And your second question about the media's role, that is very important. And I believe even health workers are not the only people who need to be incorporated. There are different people, and there's a part of the press statement that we mentioned that the government must recruit and utilize the expertise of different individuals in different areas if we are to succeed. So we didn't mention each group individually, but that's what we meant when we said the government should recruit the expertise. You media people do a phenomenal job. We cannot get this message across if you're not here to send it. So you are playing a particular role, and I think we are asking the government to incorporate you at the core, just as we as health workers are also supposed to be at the table making these decisions and helping to curtail it. I remember the very important role the media always plays in these instances. I was here during Ebola time, I saw it. I was here during the first, second waves, I saw it. And this is no exception. You have very important role that we believe you should play, and you should be given the opportunity to play that role. And it is the government, through the health institutions, that should help to reach out to you. We are also here to support, your work.
Yeah, let me just follow up on the question with the travel law, that question that you answered regarding the travel law, because you are a very dedicated professional institution.
Yeah.
And I think the government to rely on your expertise and some of your pieces of advice to it. So I don't know, because that was not highlighted in your press conference regarding restriction or closure of the airport, because if we have people coming in and out, we will continue to experience the onset of this virus in our country. So I don't know, how are you looking at that, so that we can start tackling the issue from the airport, we can enter the communities.
Okay, so there's a part of the press statement. In fact, the very first recommendation to the general public that we should all adhere to safety measures that have been released by the government of Liberia. By that we mean all safety measures that were released by the government of Liberia should be adhered to, including the closure of the airport. Remember, the safety measures that were released by the Minister of Health indicated that for the time being they were restricted traveling from certain countries. So we are saying all those safety measures are scientific, they are okay, they are appropriate, and the citizens in general should adhere to all of them. In addition, we went on to recommend other things that the government should consider doing. Again, like you said, we are a professional body. We are made of doctors and dentists, and we work with other paramedical staff. And we do know the role we play in these fights. We do know the disadvantaged position we assume during these fights when things are not done properly. We as health workers, we die a lot. A lot of us get infected, our families die. And if you can recall, during the Ebola time, there were families that were swept entirely because either the health worker, who is a member of that family, contracted the disease and went back home. So we are seeing these things, and we are experiencing in live moment all of these things that are happening, and we think this is nothing that we've seen in the past 18 months. This wave is dangerous. This wave is killing a lot of people. This wave is causing a lot of severe diseases that we've never seen before. So if we are to get extraordinary results, we need to act extraordinarily. And that's why we're recommending these measures. We're not mandating the government, but we are professional bodies made of scientists, and we are looking at the science involved with COVID-19, and we are making recommendations after consulting our body, our membership, using their different expertise. So this is our position to the government and to the general public.
Okay, I just want to add up to what Napoli just said. The Liberia Dental Association have a very good respect, immense respect for the media. Because we consider it as what? Positive media for what? Change. We communicate information to the public. So we want to also call on you and your police and I'm not here to give out the positive information concerning the fight against the coronavirus disease. Because there are a lot of conspiracy theories going out there. So we depend on you. The public depends on you. So that those scientific information that are certified, that are good, that are authorized, will be able to get out to the public. Because our people always carry misinformation. It's an appeal that I'm making to you, especially the media people who have regard and respect for you, that you play a central role, a pivotal role, disseminating information. You can bring about a positive change. And I know a lot of people follow you either on social media or through the what? Through the airwaves. That many people can always be new people, but for social media and smartphone, a lot of people go on smartphone and we can share information. So if the public is sharing information, let them share what? Positive information that will bring about change and that will bring about an end to the coronavirus disease.
Okay.
Yes.
My question.
I'm Josephus Betty from Cuba. Thank you so much. My attention has been drawn to moving vehicles. There are times we all listened recently to the Minister of Health. Why it is true that we all say each one, help them. And I listen to you attentively. There are times we catch riders, motorbike riders, sometimes they violate, and our own security sit and look at it. But like you said in your statement, an accident you rarely mentioned. So what's the message in moving this process forward from the security end?
The message forward is government has announced some new measures to enhance the safety protocols. But from what we are seeing, it is not being adhered to, and people are still not following the situation. So this appeal is, we think a lockdown and a mandatory enforcement of the health protocol be necessary. Because when you wear masks, you protect yourself, you protect the last person, and you protect the health worker. So we are saying that what was announced was okay, but I think we need to go further beyond. We have to find a way to enforce it, and we have to find a way to explain to people the reason why. So that's why we are engaging the press. That's why we are coming out with a press statement. We need to do more. We are doing something, but it's not working. We need to do more. The situation is alarming and it's getting worse every day. I want to say something about that.
Well, basically I've said that the opening statement of our recommendation to the general public is to adhere to these measures, including limiting the number of passengers in vehicles, or using those masks at all times. You know, just about all these recommendations that were scientifically based for which they were released. We are in support of all of them. But going a step beyond that, we want to be more robust, because we have not seen much of a change since those safety measures were released. Everything seems to be going just as they were before the release of those measures. That's why we are coming in to recommend the next step, which we believe should be a total lockdown, at least for a period, to be able to really enforce some of these things that have been brought up initially.
Yeah.
So I think we'll take the last two questions, and we will wait.
Okay.
Yeah.
My name is Francis Skipper, and I report for Spoon TV. My question has to do with accountability. I listened to your press release, and you are asking individuals, institutions to at least make donations in the fight of this COVID-19. But I did not hear you speaking on anything about how those donations will be accounted for. And we are yet to still get information on how much the government and the Ministry of Health have collected from the RIA and what that money has been used for. So what's your take on that?
Okay, maybe I should respond or you respond.
Yeah. Thank you very much. That's a genuine concern. Accountability is key. But as an association, we want to augment and buttress the work that government is doing. But we should also insist that whatever fund is available, there should be a mechanism for accountability. I don't know how that will work, but as we get incorporated, we can make some suggestions. But what to say is crucial, that accountability and people feel the impact of their donations. Maybe Dr. Kuya can say something about that.
Yeah.
Well, now with accountability is something that we all do. And we know that government have mechanisms in place in terms of financial accountability. But we have to be honest with ourselves, and we have to be sincere, because we are fighting an unknown enemy. We don't understand the disease. People are still learning about it, more information are still coming up. So we want to call on the government. You have a very good financial accounting protocols, standard operating procedure, but we want you to go beyond that so that the public will know that the money that is being collected is being used to fight in order for us to overcome the viral disease. It's not an easy thing that we're going to do, but we know that with some level of honesty, with some level of integrity, we as a country can tell the outside world that look, we know how to manage ourselves, we know how to account for things, and we can make it. We can use the money, we can account for it, and then the public confidence will grow in us. So that's an appeal for the government. Please do the best you can do. The Ministry of Health, the NFIL, the government, and all international partners come up with your help. And I believe that our leaders will be able to come up with full disclosure of how the money was used, and it will be transparent to the satisfaction of everybody, including all Nigerians.
Okay, I'm Mike Gray, again from the KMTV. There's current vaccination of the coronavirus vaccine that is ongoing in the Republic of Liberia. But still, have now won the trust of the Liberian people. So you as some health expert, what do you think can be done to be able to win the confidence of the Liberian people to have themselves vaccinated?
Okay, thank you. I think what we as Liberians should do is to stick to science. That's what we need to do. There have been many diseases around the world in the past that were claiming many lives, including measles, including polio, including diarrhea illnesses, chickenpox. All of those diseases were major public health problems, just as you see corona or any other disease is now. With time, scientists developed vaccines to prevent people from getting those diseases. The scientists use science. They don't use politics. They use science. And when they invent or they produce any vaccine or whatever, there's something called peer review. There are X number of scientists that will counter-check, do check and balance of these processes to make sure that whatever is produced is safe and that it is actually efficacious, meaning that it is able to do the job that the inventor say it will do. Then beyond that point, it goes through what we call clinical trial, different stages of clinical trial. They first try it on animals, then they try it on people, and then they go through all those stages before the Food and Drug Administration, which is the FDA, can approve. So it does mean that anytime the reputable institutions, the World Health Organization, the Center for Disease Control in the US, anytime they come up to say this is a medication or this is a drug or this is a vaccine available, it means that it has gone through at least, for the bare minimum, an emergency screening. If there are times that there's a problem that you cannot go through all the stages, we have something we call emergency authorization. But it doesn't mean you just bring the drug and just start using it. No, it goes through specific trial to establish the safety and efficacy. All of the vaccines available right now around the world have all gone through those stages to get emergency authorization approval. With that in mind, Liberians should believe and stick to science. There are lots of conspiracy theories about vaccines are being used to kill people around and all of that. We should try to give disclaimer as a government, as health workers. We should give the information, and as citizens, we should all go out to seek information. All of these vaccines that are here, they are safe. I have taken my vaccine, he has taken his vaccine, he has taken his vaccine, we are doctors. Do you think we are prepared to die right now? No, we're not. But we know what is scientific, and the vaccines that have come are very, very established to be safe and efficacious to an extent. So it's a general message to all of us Liberians. The health workers, the general public, the government officials, everybody has to be aware that we need to stick to science. In the US, they have vaccinated over 311 million. They are giving up to over 311 doses of vaccine to their citizens. Are you telling me that the Americans are trying to kill all their citizens? No, they're not. In India, They have, I think, over 200 million vaccines now already, even though there is, massive spread of the virus. So what we have to say as a professional body and as a scientific body made of medical doctors and dentists, we are saying to the Liberian people that these vaccines have been established to be safe in the particular group of people that have been talked about. Pregnant women and children have now been authorized to take the vaccine because they were not in the original clinical trials that led to the authorization. So adults are encouraged to take the vaccines. We all should take the vaccine because although it doesn't prevent us from developing the disease 100%, all right, there is a high chance of prevention if you took the vaccine. Or even if you took the vaccine and contracted COVID, which is still possible, your chance of having very severe disease is low. So those are all some positive gains. At the moment, we should be looking at the risks and benefits and analyze them. That is the way to go. So we are proud enough as an association to announce to the general public that please take the vaccine. We've already spoken to the government in this press conference that the government should make every effort to secure more doses of vaccines because the population has to be encouraged to take it. I think this is our best chance out. With all the other measures we are considering, adding vaccination across the country will be a major step in helping to curtail this disease. So with that, we want to say thank you to all of you for coming, our media persons. You're always our partners. You always carry our message. And we are very grateful that you all were able to make it. We just joined the president to officially close the conference.
Thank you. On behalf of the Liberia Medical Dental Association, we also want to take this time to express sympathy to all those that lost their life to COVID-19. And even those that are undergoing treatment right now, we share their pains, and the doctors and other healthcare professionals are committed to do whatever possible to help get them in recovery. But there are many challenges. We need oxygen, we need oxygen delivery, we need medications. And we also have to provide for other routine services. So the healthcare is stretched and overwhelmed. So we are asking government and development partners and the citizenry to reach out and let's all collaborate and work effectively. And lastly, I want to plead with all Liberians and foreign residents in Liberia. Please adhere to the safety protocol. Prevention is the key. That's how we're going to break the transmission. And please get vaccinated. Thank you very much.
So that's how we come to the end of the press conference here of the Liberia Medical and Dental Association. We had a compound of the JFK. So my name is Michael, reporting for KMTV. I'd like to say bye-bye and do have yourself a wonderful day.